Blood has been called the river of life, transporting various substances that must be carried to one part of the body or another. Red blood cells are an important element of blood. Their job is to transport oxygen to the body's tissues in exchange for carbon dioxide, which is carried to and eliminated by the lungs. Red blood cells are formed in the red bone marrow of bones. Stem cells in the red bone marrow, called hemocytoblasts, give rise to all of the formed elements in blood. If a hemocytoblast commits to becoming a cell called a proerythroblast, it will develop into a new red blood cell. The formation of a red blood cell from hemocytoblast takes about 2 days. The body makes about 2 million red blood cells every second. Blood is made up of both cellular and liquid components. If a sample of blood is spun in a centrifuge, the formed elements and fluid matrix of blood can be separated from each other. Blood consists of 45% red blood cells, less than 1% white blood cells and platelets, and 55% plasma.
What are normal and high triglyceride levels? This video is one of the series that answers the most commonly asked questions about triglycerides and cholesterol, brought to you by allaboutloweringcholesterol.com, the leading cholesterol-lowering website visited by more than 1 million people per year. Having normal triglyceride levels is important to stay healthy and prevent heart disease. To measure your triglyceride levels, you simply need to do a lipoprotein profile. This is a simple blood test to measure the levels of triglycerides and cholesterol. Triglycerides less than 150 milligrams per deciliter are considered normal, 150 to 199 as borderline high, 200 to 499 as high, and levels 500 and above are considered very high. Whatever the case, if you have high triglycerides, level above 200 milligrams per deciliter, you need treatment, including medication, lifestyle changes, diet changes, and losing weight if obese. You can achieve normal triglyceride levels by eating healthy and simple foods, regular exercise, and losing extra weight. Triglycerides are a major source of fat stored within cells. These fats provide you energy and have many other important functions in your body. So, regular monitoring of your triglycerides will help prevent many diseases. A simple lipoprotein profile is conducted to measure triglyceride levels. To view the entire video series telling you all about triglycerides and cholesterol, causes of high triglycerides, medications, treatments, and more importantly, how to lower triglycerides naturally, go to allaboutloweringcholesterol.com/triglycerides.
Triglyceride medication, side effects and safe alternatives. There are a number of conventional triglyceride medication available in the market used for triglyceride-lowering purposes. More than 85 million Americans with elevated triglyceride and/or cholesterol levels seek medical help in US alone per year. The American Cholesterol Education Program Expert Panel's current policy on fasting blood triglyceride levels in adults recommends medical intervention in patients with triglyceride levels in range of 200 to 499 milligrams per deciliter, 2.35.64 ml. Following are the triglyceride-lowering drugs you can find in the market. 1 Triglyceride medication group 1, statins. Statins belongs to a famous class of cholesterol-lowering drugs commonly prescribed for cholesterol and triglyceride level reduction. Statins block a key liver enzyme involved in production of cholesterol in liver, thus slows down its production. Statins enhance uptake of bad cholesterol, LDL cholesterol, by the liver and removing extra cholesterol out of blood. Other important use of statins is in people at high risk of developing heart disease, particularly those with high blood pressure, family history of heart disease, diabetes, and with high levels of bad cholesterol. 1.1 Statins, side effects. Statins are safe and free of side effects. However, in some people following side effects have been observed: gastrointestinal upsets, skin rash, sleep disturbances, headache. Statins are not recommended in person allergic to any of its components, patient with advanced liver disease, pregnant or breastfeeding women. 1.2 Statins, brands available. There are a number of statins available in tablet or capsule form, including Zocca, Lescol, Lipitor, Mevacor, Pravatal, and Cresta. Zocca is the most famous and one of the best-selling statins around the world. It is added to diet if diet control alone has failed to achieve target levels. 1.3 Statins plus grapefruit juice, not a good idea. If you are using statins for as triglyceride medication to lower high cholesterol and/or triglyceride levels, you should not use grapefruit juice. Grapefruit juice is known to contain a chemical which deactivates the liver enzymes required to break down the statins. This can lead to abnormally higher concentrations of drug and blood, causing toxicity. 2 Triglyceride medication group 2 Fibrates. Fibrates are a group of triglyceride-lowering drugs known to reduce the triglyceride levels by 20 to 50%. Fibrates are available in capsule and tablet form, and most common brand is Lopid, Gemfibrozil. Lopid is a prescription-only drug used as a triglyceride medication and used primarily in patients having raised cholesterol levels associated with high levels of triglycerides. Lopid is also given in patients with very high levels of triglycerides, thus at risk of developing inflammation of pancreas, pancreatitis, and blood clotting problems. Other benefit of fibrates is that they increase your good cholesterol, HDL, by 10 to 15%. Fibrates are commonly prescribed in patients with hyperlipidemia and diabetes, and these patients' abnormal levels of lipids are often associated with high levels of triglycerides and low levels of good, HDL, cholesterol.